Hey mamas, have you just been told that your baby is breech and you have a ton of questions? I get a lot of questions from my previous YouTube video as well as my clients about breech, so today I'm going to answer those for you. But before I begin, my name is Midwife Kira and I believe in truly natural birth because I know it makes for better birth experiences. Consider subscribing to my channel and joining in today's conversation about questions about breech. On my previous breech birth video, Mama Bear Vlogs asked me a question about how early in your pregnancy that the Leopold's maneuver can be used to successfully identify a breech. So first of all, this only helps if your provider is actually using the Leopold's maneuver, and many healthcare providers are not, but midwives do. And so if you're having someone who's experienced with the Leopold's maneuver, then I would say between 30 and 34 weeks of pregnancy, you can clearly identify with the Leopold's maneuver how to identify a breech. Keeping in mind that at about 32 weeks of pregnancy, only 16% of babies are going to be in the breech position. So it's a very good chance that your baby's already going to be head down. By 37 weeks of pregnancy, only 3 to 4% of babies are going to stay in that breech position. So a lot of people have started to freak out about their breech babies at that 20-week anatomical ultrasound, that at some point somebody makes a mention of the baby being breech, and at 20 weeks it really does not matter. That is plenty of time for your baby to flip. Now, although we can identify breech at 30, 32, 34 weeks of pregnancy, I really don't start encouraging my moms to kind of get proactive per se to flip their breech until 32 weeks of pregnancy, which leads me to question number 2, which is, are there natural ways to flip my breech baby? And the answer is yes. Keeping in mind, however, that most babies are going to flip by 37 weeks. But let's talk about those options. One of the most common things that we can do during pregnancy is simply pelvic rocks. So pelvic rocks is a simple way that we can open the pelvis and use gravity to put baby in the optimal position for the birth. Pelvic rocks, hands and knees positions, which I've talked about in how to flip my sunny side up baby video, and really just optimal positioning to help baby flip into a more comfortable position, which for babies is head down. Now, other ways that many people have asked me about is the Webster technique. Now, the Webster technique can be used by a Webster certified chiropractor, and this technique has been shown to be extremely successful in opening the pelvis and allowing baby to flip head down. The Webster technique from a licensed chiropractor is not a manual external version of the baby. They do not turn the baby. Simply, it's just allowing the pelvis to open and basically letting the baby do its job to get more comfortable. In addition to the Webster technique, licensed acupuncturists can use moxibustion to help flip your baby. So I talked to my acupuncturist today before shooting this video, and he actually recommends moxibustion for 1 to 2 days, up to 10 times a day. And so basically an acupuncturist is going to teach you how to use this point on yourself, and you're going to go home and about 10 times a day you're going to apply some heat to this point, and within 24 to 48 hours hopefully you'll feel that big old flip of baby going into a head down position. Now, in addition to that, there's also something called an external version. Now, this is kind of a last resort when it comes to flipping a breech baby, because an external version is a physical manipulation of flipping the baby into a head down position, which, as you can imagine, carries some potential risks. And so this can only be done by an OBGYN. Typically, they do it in the hospital. And it depends on where you're living, where your doctor's practicing. But my doctor here in Lafayette, when he does external versions, he typically admits the mother also for an induction immediately after to prevent the baby from flipping. An external version has been shown to be successful in flipping a breech baby into the head down position over 58% of the time. And a skilled doctor will be able to probably have higher success rates. So although this is a last resort, it is a pretty successful method. And with that said, my chiropractor has said that her success is almost 95%, assuming that clients follow through with her advice on coming twice a week, doing their pelvic tilts, which we talked about before, and that hands and knees position. So it's really, really important that you keep in mind when you're ready to start being aggressive about a breech baby, that you are prepared to take extra steps. There's no like one size fixes all. You really need to take the extra steps of pelvic rocks and positioning to help your baby into the most comfortable position. So Bernadette on my previous breech video had asked me how we can tell if the baby is head down versus breech. And again, this isn't really something we can accurately identify on our own. Coming from a midwife who was pregnant and trying to do the Leopold's maneuver on myself, it's just not very accurate. I can tell you all the things about having the cute little kicks at the top or the hiccups down deep in your pelvis, but the fact is the only way to truly identify a breech baby is to have an ultrasound or a Leopold's maneuver done by someone who practices it often. When should I worry about a breech is a question that I often get asked. And so I tell my mamas not to even start worrying about breech babies till at least 32 weeks. I really don't start to get uncomfortable until about 34 weeks, where I start having them see a chiropractor certified in Webster. Unless they're having other problems such as severe back pain, pelvic pain, things like that, then I would start at 32. So don't worry about your 20-week breech baby. Don't even start worrying at your 30-week breech baby. Hang on until 32 to 34 weeks before you start feeling like you need to intervene to help your breech into a better position. So one very common question I get asked too is, can I have the baby vaginally if it's breech? So only 3 to 4% of babies will stay breech after 37 weeks. Yes, you can actually deliver a vaginal breech birth, but there are some potential risks that you would want to be aware of when it comes to delivering a breech vaginally. First of all, the most important thing I want you to know is when it comes to delivering a breech vaginally, the first thing you need to do is find a skilled provider in breech delivery. They have really good success rates with minimal risk to mom and baby, typically. However, one of the biggest risks to a breech delivery is potential head entrapment. And what this means is, when you're having a vaginal birth, the head molds and shapes that cute little cone head babies have. And it allows the widest part of the baby, which is always the head, not the shoulders, to come through the pelvis, so we know that the rest of the baby's going to fit. Well, when it comes to a breech, we pass all the parts of the baby all the way to the shoulders up to the head. And when the head is left, it doesn't really have time to mold in the pelvis the way it would have vaginally, and it does increase the potential risk that the head might get trapped during the delivery. Now, this does not happen very often, but it is a real risk that you would want to consider. In my experience, when I've seen a physician deliver a baby breech vaginally, they do it in the operating room at a hospital under a lot of consents and a lot of team on staff in the operating room, just in case of that potential reason. Other risks associated with delivering a breech vaginally would be a potential risk of cord prolapse, and this is where the cord comes out in front of the baby, and also a potential hemorrhage for the mother. Samantha had asked on my previous video if the Leopold's maneuver would work if there was an anterior placenta, and the answer is yes. Once the baby's a certain size, we'll be able to feel all of the parts of the baby with the Leopold's maneuver, no matter where the placenta is. Despite whether or not your baby is breech or head down at 37 weeks, the fact is that your baby is more than likely going to flip head down. And so it's really important that you get prepared for a vaginal birth either way, because there's a good chance your baby's gonna flip. So I created a handout for you guys I'm gonna list in the description below on things that you need to pack for your birth that your friends probably didn't know about. So you can go ahead and sign up for that below. If you wanna know a little bit more about how we use the Leopold's maneuver to identify whether your baby's vertex or head down or breech, I'm gonna go ahead and post a link to my how to use the Leopold's maneuver video right here. Otherwise, I'll see you guys on next Midwife Monday video. Thanks for watching. Bye-bye.